And to begin off with the conversations in this last and final hour, ear infections and hearing loss in children is an important topic, as ear infections are one of the most common issues pediatricians encounter. They can lead to a range of symptoms, which is discomfort, and also in some cases long-term complications like hearing loss. This morning we're joined in studio by our usual pediatrician, Dr. Landuleni Benjamin, just to shed more light on that. Doctor, it's always a pleasure having you in studio. Good morning.
Good morning.
All right.
Thanks for having me.
All right. Just to start off, doctor, how common are ear infections in children, and why are they so prone in children rather than adults?
Ear infections are quite common, and there are various reasons why they are. But I think for starters, children are quite vulnerable, specifically around 6 to 2 years of age. It's the age where they are quite vulnerable. And there are few conditions that can predispose them to this. And among them is their own environment. And obviously with environment, you have people who are smoking, pollution, etc. It's quite strange how all of this affects the ears, but it does.
Yeah.
And then obviously feeding, specifically the feeding methods. Breastfed babies are usually protected as opposed to formula fed. But we also know what milk can do. But more important is the positioning when you feed. Bottle-fed baby can be fed while lying on their back, which you hardly ever do with breastfeeding. So that can also predispose them. And as you know, the ear and the nose and the throat are connected. So milk can easily spread across and get into their ears and leading to an infection. There are also specific medical conditions. Individual with allergies may be predisposed to this, and asthmatics, etc. So there are a few things that can predispose, but age by far the most important factor, as well as few other conditions. So adults usually don't have the same issues.
Yeah.
So of course they have immune system, because immunity is the other predisposing factor, lack of immunity or underdeveloped immune system that leads to this.
All right. Doctor, what are some of the typical signs and symptoms that parents should look out for when it comes to their children's perhaps getting infected, getting ear infections?
The majority of them tend to either touch their ears or rub it vigorously. Sometimes they cry, and you can see the intensity on their faces that they are in quite excruciating pain. So,
Yeah.
so the level of pain you often suggests to you there is a problem. Occasionally you see that there is maybe a discharge from the ear, and few of them, they seem not to respond quickly when you call them. These are the ones that may now experience some reduced level of hearing, which is often referred to as conducting deafness, meaning that because the eardrum, the infection is behind that ear. And the eardrum, behind that eardrum, you also may have fluid accumulation, which interferes with the normal conduction of sounds.
Would you say deafness is the worst case scenario that could happen to a child who perhaps experiences an ear infection?
It's not the first one that comes. Obviously, it may be a complication of an ear infection.
Yeah.
By far a complication, and usually individuals who have bacterial infection as part of their ear infection as opposed to viruses.
Yeah.
But yeah, it's always a concern when it happens. The majority of them are temporary, but obviously you worry about permanent ear loss.
Yeah. And how prevalent is this condition?
If treated, you usually don't see it, but
Okay.
obviously if you ignore what is happening,
Yeah.
you may end up with a hearing loss,
All right.
which may be in one ear or both.
How are how are ear infections diagnosed? Are there perhaps is there always a need for children to be on antibiotics or have antibiotics?
First of all, in terms of a diagnosis, it's usually a clinical diagnosis. We have something called an otoscope. It's a little light, and it has got a little thingy that you put there, usually black, but you can have white and other colors. Basically, it allows you to visualize the ear. And very often, in a normal ear, you see shining of the eardrum. that when it disappears, it may suggest that there is perhaps something else behind that ear, and that's the reason. Usually fluid, and you sometimes hear the term effusion, because the shining, which normally sits there, which is usually found, then disappear because there is fluid. In terms of how treatment, the problem is there's overwhelming use of antibiotics.
Yeah.
And with that, you tend to come across individuals who are not responding to antibiotics. So that's one of the biggest challenges, resistance. And the resistance is often caused by not judicious lack of knowledge, or perhaps the manner in which we use antibiotics sometimes make it difficult for them to respond. And occasionally you may have the wrong diagnosis. If it's a virus, obviously you're not going to get a response. But be as it may, ear drops are often used, and some of them are eye drops that are used into the ear, and they work quite well. And obviously oral antibiotics to some extent has been used. But in the end, you need to have a proper diagnosis in this individual, so that some of it is just to relieve the symptoms. And the pressure within the ear is quite painful, because it's the reason why they are in deep pain. So relieving it may be one of the best way to treat them, and then you can then try and apply. Part of the challenge is getting that antibiotic across. Remember, there's a membrane in front of you, and it has to cross and get into the other side to get the treatment going.
Yeah. Doctor, can reoccurring ear infections lead to hearing loss in children? And if so, how serious can it get?
Recurring is always a problem, because you remember, anything that keeps repeating itself is likely to end up with a permanent damage along the way. So I think it's one of those that you don't want to see, and they ought to be seen by the ear and throat specialist to make sure that they are treated correctly.
Yeah.
But it can lead to hearing loss, and therefore you don't actually want them to have these recurrences. I think once diagnosed, what I tend to do is, after I have treated them, even if they've responded very well, I still tend to send them to the ear and nose and throat specialist,
like once in a while,
to re-examine them carefully, because they have better equipment in terms of how to look at the to west up to the eardrum, and also that's their area of specialty. So they will be the best person or the best people to look at the child, making sure that there is nothing else that has been missed. Foreign body may be the reason why you haven't cleared the ear, and that's why you need somebody to, because little ones are very naughty, they put things everywhere. So it would be ideal for somebody to look carefully and exclude other things as a reason for recurrences.
Yes. But doctor, can hearing loss caused by ear infections be reversed?
Yes, it can, because by the majority of them is not nerve deafness. Remember, nerve is the one that is a bit more difficult to reverse. This is usually conducting, so you can look at the eardrum and see how well it can be, because it can heal very well. So it's just making sure that everything has been looked at carefully and treatment done correctly.
Yeah. Earlier on, doctor, when we started the conversation, you mentioned so many different factors that causes ear infections. What are some of the things that parents should look out for, or perhaps just some of the don'ts that they should keep in mind just to avoid their children perhaps getting ear infections?
There are a few things that they can do, and I think one is to breastfeed. And breastfeeding is really something that we want. It not only is it good for ear infection, it's good for their overall well-being and growth and development. And obviously we would want them, if bottle feeding, the positioning is very important, that they don't feed them while lying on their back. And then obviously certain things that we can do.
So how should they be?
You hold them like on
like
the side.
This. Okay.
But not, you often see the little one lying on the back, holding their own bottle and drinking. That's the position you do not want.
So that is a no-no.
That's a no-no.
Okay.
So make sure that you lift up that head a little bit at least 45 degrees. Should be good enough, and then they can drink. And then other things that we can do, things like smoking. We can eliminate it from our environment. Obviously, pollution may be difficult because it's something outside, but smoking, we can do something about it. And then individual with family history of hearing loss, you perhaps need to take them to the doctor much earlier so that they can be examined. And then few things like allergies, because allergy often ends up with inflammation, and it's that inflammation in that space that leads to the ear infection. So those allergies and asthmatics ought to be seen a little bit earlier, especially if they keep rubbing their ears, etc. So you need to take them to the doctor so they can be seen.
All right, we've seen earbuds for babies. Do you think those are advisable to use?
Earbuds are very, I do have my own approach to them. I think they are useful, but the problem with them is if not careful, they may end up during cleaning, you may end up dislodged, and they end up breaking off or whatever happens. The cleaning, for one, many parents are quite scared to do it. So, and when you are scared, you are likely to make mistakes.
Should we bring them to you, doctor, the pediatrician?
No, there is a place for them, but don't go too deep.
Okay.
Let me just put it that way.
All right. Any final remarks before we let you go, Doc?
Yes, ear infection, I think, it's just one of those things that we see quite often. And as I said, little ones can put foreign object into their ears, so be mindful of that. And then the other thing is to just make sure that when you see them rubbing their ears too often, make sure they have been checked out before you just assume they're being naughty.
All right. Well, doctor, it's always a pleasure talking to you. Thank you so much for talking to us about ear infections in babies. And hopefully for the parents who are listening right now, they definitely got something. And prevention is always better than cure. Thank you so much for joining us.
Thank you.
All right.